I'm Dr. Ariel Garfinkel, or you can call me Dr. Ari, whatever works. But the reason why I started the Smile Garden was because I was just really excited to create a dental space after being in the dental field for over 9 years. I was just ready to create my own space with a more relaxing feel and provide a space and an opportunity to talk to patients about not just their dental health, but how their dental health connects to their overall health as well. A dental bridge is a great option for patients if they're missing a tooth and they want to replace it. And if they're not really interested in doing a surgery, maybe they're not a candidate or they don't want to do an implant. And so a dental bridge is a much faster way to replace that tooth, where we put crowns on the teeth next to that space, and then we connect them together with three crowns, one on each of the teeth on either side of the missing space, and then one right in the middle that sits on the gums and gives the patient an opportunity to chew in a spot that they weren't necessarily able to before with that tooth missing. When someone's missing a tooth, they have different options. They can either get a bridge or they can get a dental implant. And a lot of times we start with just the medical history. Is someone a candidate to undergo surgery and get a dental implant? Also, timing. Dental implants are a longer process. We call them slow cooker dentistry. And dental bridges are a lot faster of a process. And so you can get your dental bridge if we prep the teeth on either side of that missing tooth. We get those ready for crowns. We take down just enough tooth structure to create enough space for those crowns, and we put those on. We usually put the patient in a temporary for a couple weeks, send the case to the lab, get a new bridge in about 2 weeks. Versus a dental implant, you really want to let that dental implant sit in the bone and fuse to the bone over the course of 4 months. Then you can put the crown on the implant so that you're able to chew with it. So when we're designing a bridge, we like to look at a couple things. The first thing is we like to look at the color, make sure that we get the color right. And we show the patient different color options to make sure that it's the right color match. The other thing we look at is the shape of the other teeth. So I like to make sure, especially if we're in the front, that when we take our impression or we take our scan, that we get all the way around the top so that we're able to compare the shape of the teeth on the other side to what we are trying to make so that it matches and it looks really even and nice. So bridges are a great option for patients if they're not looking for a surgical replacement for a tooth. And again, if they want something that is maybe a quicker way of getting a tooth replaced. And so bridges are a great way if the teeth on either side of the missing space are healthy and can withstand a crown. Sometimes teeth are not really able to hold onto a crown. And so maybe we need to go further beyond that tooth. But it's a really great, quick way to replace the tooth that is a permanent option and is cemented onto those teeth on either side of the missing tooth so that it stays in when they eat, when they sleep, when they brush their teeth, and they don't have to take it out. So a lot of times patients are so excited once they get their bridge put in because they've had this missing tooth for maybe a long time. And now they finally just got it replaced with this awesome new permanent restoration that's glued onto the teeth on either side. And they don't have to remove it when they eat or go to sleep or brush their teeth. And they're just so excited to be using it and have that chewing ability back and maybe even some of those cosmetic benefits as well. So I've been practicing dentistry for over 9 years at this point. So I've done a lot of bridges in my day. And one patient I can think of particularly, they were missing a lower canine for a really, really long time. And what happens is when you're missing a tooth, especially in the lower for a long period of time, that bone tends to shrink and gets really narrow and thin. And so she was no longer a candidate for an implant. So we talked about a bridge option to replace that missing tooth. And what happened is we found that when we matched the shade perfectly and we made a design that fit the rest of her teeth and looked really nice with the rest of her teeth, that it not only gave her chewing abilities that she wasn't necessarily expecting to gain, she was really excited to gain those extra chewing abilities. She felt like she was able to now chew on that side of her mouth And she loved that when she smiled, she didn't see that missing space anymore and just loved how her face looked in pictures now. One of the things that makes our office so unique, and especially when you're getting some more major dental work done, like a bridge, is that we really make sure to listen to your concerns, take the time to hear how you're doing, hear how you're feeling, and make sure that you are comfortable. We're not rushing through things when I'm doing the anesthetic. I'm really taking it slow, taking my time. So that shot, I know that shot can really hurt. And so I really want to go slow with it, make sure that it's not burning, make sure that your heart's not racing. Sometimes that can happen with the anesthetic, and just make sure that you're comfortable, that you know what is going on, and that you feel ready for the procedure. So, a great way to care for a bridge is to use floss threaders or super floss, where you're able to thread floss under that fake tooth that's just sitting on the gum there. And so you're able to really get under there and clean under that bridge. That's really important for maintaining a bridge so that you don't get cavities on either side of that missing tooth. Those teeth that are holding the bridge in place are really important teeth to keep clean and prevent getting cavities. So, if someone's been missing a tooth for a really long time, I like to talk to them about different options that they have to replace that tooth. Some of those options are removable, where you can take it out, and some of those options are permanent, where we place the appliance in with cement or screw it into bone with an implant. And so a lot of it just depends on what patients' preferences are. If they want something they can take out or something they can keep in. If they want something they can take out, we can talk about partials. We can talk about, also flipper, maybe some people have heard of. The other option, if they don't want to take it out, if they want it to stay in, is we could talk about a bridge, or we could talk about a dental implant, and just talking about how replacing that missing tooth could help them with their chewing abilities, help them with their cosmetics and their smile. I see a lot of times that patients have a missing tooth and they kind of hide their smile. They don't give the big smile that they really want to give. They kind of hide their smile, and they don't realize that they're holding down their smile because of a missing tooth. And so it really can kind of give them that freedom to really express their emotions, give them more chewing ability that they didn't realize they were missing out on, and just kind of change everything for them, for their cosmetics, for their chewing abilities. And it's a really great opportunity to talk about different options.